Welcome to this episode of the Fresh Heart Project. We're delighted to bring you the second part of my interview with Dr Rupy Aujla. Rupy is an NHS general practitioner, a cookbook author, and founder of the Doctor's Kitchen. In the last episode, we discussed how you can improve your diet and why he believes food is medicine. This episode is much more personal because he opens up about his own health journey. Rupy was a newly qualified junior doctor in the middle of a busy shift when he checked his pulse and felt his heart racing. He was found to have atrial fibrillation, a heart rhythm disorder which causes an irregular heartbeat, often running very fast. Rupy found himself in a difficult and vulnerable position on the other side of the doctor-patient relationship. Join us as he shares how small, sustainable lifestyle changes brought the atrial fibrillation under control, and how his journey then inspired him to create the Doctor's Kitchen, which is a platform to help educate us about the beauty and medicinal qualities of food. Rupy, thank you so much for agreeing to share your journey. I think it's a really important one, and it's certainly what highlighted me to your work. I came across your podcast a few years ago. I think it was a couple of years ago, maybe 3, and just listened to that first podcast where you describe your journey, and you describe your journey with atrial fibrillation that we'll talk about and the impact that that has had on you. So thank you. I really do appreciate that you've agreed to share that with us. But I just wanted to start by taking you back to your childhood and talking about food. How important growing up was food in your household?
Super important. So my mum was a really good cook. She would whip up things from all different sort of cuisines, Italian food, American food. We used to have a big frozen freezer where we'd make like loads of different, convenience foods as well as like foods made from scratch, and obviously Indian food as well. So I think that was definitely some of my earliest influence when it came to cooking.
When I was young, I remember, at the age of, I think, 6 or 7, my mum used to drag me kicking and screaming into the kitchen when all I wanted to do was
Yeah.
ride my bike and say, you will learn how to cook. And I hated it at the time. But I'm so pleased that I've now got those skills because I actually love cooking and I really build on what she taught me back then. Did your mum teach you skills back when you were young? Were you involved in cooking as a child?
So I wasn't involved in cooking as a child, but just before I went to medical school, she taught me a few different recipes, and one of them was my Thai lemongrass curry. And I went to medical school with this sort of reputation as being someone who could cook because I could cook this one dish, and it was a very involved dish. It was galangal, lemongrass, and coconut milk, and all the rest of it. So
Sounds
that kind of
amazing.
reputation stayed with me, and yeah, exactly. And so, but yeah, that was when I started my cooking journey, just before I went to medical school.
Yeah, and medical school certainly has a reputation, doesn't it, for being quite alcohol fueled and quite sort of late
Yeah.
nights followed by a greasy kebab. Did you partake in that, Rupy?
Yeah, no, definitely. Yeah. I mean, I wouldn't say I was a heavy, regular drinker, like some of my colleagues, unfortunately. But, every now and then we definitely go out the weekends, we'd go to the socials. I was part of the hockey club. But my diet was generally okay. It wasn't that bad, actually. Obviously have sandwiches and just regular sort of student food. But generally, like, because I knew how to cook, I would make chicken in the evenings. I went to the gym quite regularly. I was working out. Yeah, I was as a normal student goes for med school. I was pretty good.
And was it 2009 that you qualified as a doctor?
Yes, yeah,
Yeah.
2009. Went to Basildon.
And when you qualified as a junior doctor, um, how did you find it? Because I know certainly for me, it was worlds apart to what I had imagined or envisaged it to be. How was it for you?
It was very much like that. It was a real baptism of fire. I was obviously working in Basildon at the time. There was I think it was the Foster report. It hadn't done very well from a mortality point of view. There was a lot of pressure. on the executives. We were really thrown in the deep end from a medical point of view. Like I remember being in F1, catering for the wards on my own, like walking down these long corridors. Like it was, and there's some very sick patients as well. I never felt like I was unsupported. I always had my reg there and stuff, but it still felt like we were always running uphill. And yeah, it was nothing like I'd experienced as a medical student, because the responsibility wasn't put on me as a medical student, and now I had the responsibility. And I remember I was working in the respiratory ward, and I was doing ABGs in the middle of the night. That's where you take blood from an artery, and we were doing taps all the time. It was during the H1N1 outbreak. It was a real difficult time. Yeah, it was very stressful. Poor sleep, poor eating habits. Those obviously follow through.
Absolutely. And it's so hard to look after yourself, isn't it, when you're doing that kind of stressful job? Because when you're a medical student, you're right, you've got that protective layer, haven't you, of,
Mm,
the responsibility of the decision making is not yours. And even as a junior doctor, you've got your seniors there. But when you're there with a deteriorating patient, you're the one who has to then make all those initial assessments and start the initial process rolling. And that can be stressful, coupled with late nights and shifts. Was it as easy to focus on, as you say, your sleep suffered, your stress, it was a stressful environment, but was it as easy to focus on food?
yeah, so it was definitely difficult. It was sort of like you just eat what you can on the job. And obviously, anything in the hospital canteen, sandwiches, all that kind of stuff. Like it was just whatever you can get, really. It was an afterthought rather than a proactive thought, for sure.
And hospital canteens are not particularly healthy, are they? At the best of times.
No. No.
Really satisfying. Big, plate of chips,
Yeah.
but yeah. Now, you then developed a condition called atrial fibrillation, which, for people who don't know, is a very common heart rhythm disorder where the electrical impulses of the top chambers of the heart, they fire in a very chaotic manner. And so instead of a nice coordinated contraction, the top chambers twitch or wobble, and then the bottom chambers follow, but in a very often erratic and fast way. So the symptoms that you get are a sudden, very fast heart rate, and it's irregular. Can you tell me about your first experience with atrial fibrillation?
Yeah, so I remember this vividly. I was working at Basildon on a long shift. It was Sunday, and I was sat at the nurse's station, and I was writing in the notes. We were seeing a patient, me and my reg at the time, on one of the wards, and my heartbeat just I just remember feeling my heartbeat in my chest, and you could see on my shirt that my heart was beating very, very fast. And it took about 5-10 minutes before I spoke to my reg and I said, "Look, would you mind feeling my pulse? I feel like I'm going a bit fast." And obviously at the time you feel a bit embarrassed, like, you know, what am I being a hypochondriac here? We've got quite sick patients to see, and like I'm getting her to feel my pulse. And she looked at me. She's like, "Yeah, no, you're going really fast. Let's get you on a monitor." She wheeled over one of the blood pressure monitors that we use to assess patients, and put the pulse oximeter on, and it showed there like 180, 190, 200. I was like,
Wow.
"Okay, well, let's get you an ECG." So
Mm,
clothes off, hospital gown on, ECG, barn door AF, which was going anywhere between 180 to 200. So that's it. Bleep was taken off me, hooked up to a cardiac monitor, admitted to MAU, which is the medical assessment unit, and I was monitored. And we did the whole thing of Valsalva maneuvers. So syringe at the time, blowing into syringe, carotid sinus massage, that didn't work, and luckily my blood pressure wasn't compromised. I wasn't having any chest pain. There wasn't any worry from a resuscitation point of view. And actually, there was a discussion about whether to give me flecainide or amiodarone or something IV. In the end, the decision was to just monitor. So I was taken to the cardiac unit, and I was monitored overnight, and my heart rate just went down over the next 24 hours without any intervention. which was my preference as well. And then I was seen the next day by the consultant, who was actually my consultant, and he was on tape that morning.
Oh,
Um,
goodness.
yeah, and I was discharged, and I thought, at the time, one-off episode, probably not going to happen. Maybe it was because didn't have enough water, or I was fatigued, or whatever. Maybe it's just one-off, but they just kept on happening, kept on happening.
That sounds really unsettling, doesn't it? Because especially as medics, especially as we're doctors, we're so used to being on the other side of the doctor-patient relationship. And it's an incredibly, having experienced it myself, and it's an incredibly vulnerable place, and we're not used to it. How did it feel being the doctor one minute and in a hospital gown, in a hospital bed the next?
Yeah, it was very it was very embarrassing. That's probably the best way I can describe it. Obviously, now I look back and it's like, there's nothing to be embarrassed about. But the
Mm,
overarching feeling was one of embarrassment,
mm,
and vulnerability. I think, yeah. And
mm.
there's this time in the MAU when I was going for my chest X-ray, and I was wheeled along the corridor to go from the MAU to the chest X-ray department, the X-ray department, and just that one little journey along the corridor with these people minding their own business, not looking at me, but minding their, walking past me. I'll never forget that. Never forget that, because I had no appreciation of just how vulnerable you feel when you're being wheeled around in a hospital corridor like that. And something as simple as a journey that happens thousands of times a day in any typical hospital, to have such an emotive impact on me as an individual, really put me in this perspective of being a patient.
Yeah.
Because 1 second, you're a doctor, and all of a sudden, the same shift, you're in a hospital bed. You have no idea what's going on.
And you actually mentioned that you were almost positioned next to a patient that you treated earlier that day. That can
Yeah,
be
yeah.
quite bizarre,
Yeah,
eh?
yeah. No, I look back at that, and it's comical now when you think about it. But at the time, she was quite confused.
And it sounds like a really unsettling, scary process, because obviously, you're young, you're fit, you're healthy, and then to have a heart rhythm disorder, even for, someone within the medical field who may have some understanding of what it means, was fear a part of the initial process for you?
Yeah, definitely. Fear was of the unknown, of like not knowing what on earth was going to happen. That was very, very strange, because I was a fit and healthy 24-year-old. I wasn't a smoker, I wasn't a heavy drinker, I wasn't overweight, never had any family history of any issues. There was no reason why I should be having these episodes. So it was one of confusion as well as frustration.
And the episodes kept happening, didn't they? And they were quite frequent and quite long. Can you tell us how often you were getting them and for how long, and what sort of symptoms were you getting?
Yeah, so I was fastidious at recording my AF episodes, which I highly encourage everyone to do as well, because you can try and figure out a pattern as to whether you do have any triggers or not. So I was having it on average 2 to 3 times a week, lasting anywhere between 12 and 36 hours.
Wow.
And I tried to look for patterns, what I'd eaten, what I'd just done before, any exercise changes. I didn't monitor stress levels, actually. In retrospect, I wish I had, because uh, my suspicion is that my stress levels had an impact on my AF episodes as well, and it's quite hard to prove that. But I think that's
Mm.
definitely one of the things that lessened the threshold for me having an AF episode. So yeah, so that those are things that I was doing, and obviously I went through the whole process of seeing a cardiologist and being given bisoprolol, a beta blocker, and I had pill in the pocket as well, flecainide, as well as all the other investigations that you can imagine. So electrophysiology studies,
Yeah.
cardiac MRIs, echocardiograms, 24 ECGs,
Yeah.
all that stuff.
And it's bizarre, isn't it, when initially your only appointment is with your rota and going into work, and then all of a
Yeah.
sudden you've got to manage all these other tests, and it sounds like you had quite a large number of tests as well. You had obviously scans to look at the heart structure and function, you had an MRI which looks slightly deeper at the actual heart tissue, and you also had what we call an electrophysiological, or EP study, which is performed by specially trained cardiologists. We normally freeze the skin in the groin, insert a catheter in there that sits in one of the veins, and through that we can direct catheters to the heart using X-ray guidance. And these catheters have small electrodes at the tip, and they can detect the location of any abnormal heart rhythms. And so presumably that was being done to look for any additional extra pathways within your heart that can trigger these episodes. And you say that, they didn't find any additional pathways, but do you remember much about that episode?
Yeah, I do actually. So it's funny you mentioned that, because it's just jogged my memory as to the discussion that was being had about whether this was true atrial fibrillation, or whether this was anything suggestive of a re-entry pathway. So the irregularity, because of the speed at which the heart was going, in certain ECGs that I had, the irregularity was being called into question. And so the EP study was performed to essentially assess the theory that this could be a different mechanism beyond those misfiring cells. But I can imagine, for someone who was purely coming at this from a non-medical perspective, it would have been quite confusing and frustrating and very
Yeah,
difficult to understand.
absolutely. And I think we can do our best to explain things, but I think it's in sharing stories such as yours where people can actually hear experiences that patients can relate. So I really want to thank you for
Mm.
being so generous with your story. And you mentioned that your episodes carried on. You were actually then going to have an ablation, which is a similar procedure to an EP study, but this time, small amounts of tissue are actually destroyed to short circuit or break the abnormal circuits and remove that trigger for the heart rhythm issues. When and why did you decide not to go ahead with that procedure?
So the decision was made to delay the procedure by 6 months in 2010, if I'm not mistaken. So my episode started in 2009, just a couple of months after qualifying as a junior doc. I went through a whole bunch of studies, all the while being on those different agents to abort any rhythms, because this was paroxysmal. So it wasn't a persistent rhythm that I was in, it was episodes. And the reason why I chose to postpone the agreed procedure, which I was very, very willing to have, is because my mum, who's not a medic, said, you really need to look at your diet and lifestyle before you consider quite a drastic intervention. And, at the time, I was a very good candidate for a 24-year-old, no pre-existing issues, no structural heart issues or whatever, even though the rates of complication are low anyway. They're much lower probably for me, as such a young, healthy candidate with no body issues, no issues that could call it into question. But really, to appease her, I decided to do something for 6 months and see, if that could have any impact at all. And I just want to emphasize, I had no idea what I was doing with nutrition back then. As you know, we don't get any nutrition training at medical school that's
No.
practical. I had to go really do a back to basics approach, and so I started with cereals and my lunches and all that kind of stuff, and then I got into meditation, and I started learning about the impact of breathing through your nose and how that has an impact on your parasympathetic nervous system, and stress reduction and sleep, and all these things happened over time, collecting more information, and all the while I was fastidiously looking at my AF episode not triggers, just the documenting of my AF episodes, and I found the gaps widening, and I couldn't really understand that, and I was all the while going back to my cardiologist saying, it's becoming infrequent. And they were like, well, it's probably a period of quiescence. You're going to need to have the ablation at some point. So just keep monitoring if you want. And it just got further and further and further, and to the point where they stopped.
That's
And I haven't had
amazing.
one since.
And what's
Yeah.
amazing is that it was just small, sustainable changes, wasn't it? It wasn't a massive change all at once. You didn't revolutionize
Mm.
your life all at once, because that is not
Yeah.
sustainable. And I think when you were seeing that benefit within your body, did that then prompt you to carry on and do more?
Yeah, I'll be honest. The initial results weren't seen in the frequency of my AF episodes dropping. It was seen more intuitively in how I felt. So I was spurred on by better energy, feeling less groggy, better gut health when I was on the wards. Not feeling like I needed a snack at 11 a.m., as was quite frequently the case when I was in ward rounds and stuff. I had my typical cereal as I was running out the door, and I'd be hungry by like 10 or 11. And instead, I took my time and I ate one breakfast. I started with breakfast. I ate my breakfast, and then I would be able to wait until midday, and then I had my normal lunch. So that definitely had an impact on me, and that's what continued me to go on. It wasn't the frequency of AF episodes. That was almost like a happy byproduct of a lifestyle that I wanted to continue leading anyway.
And you were called Tupperware Boy, weren't you, at one point?
Yeah, because I always used to bring my Tupperware into work, and so my consultant called me Tupperware Boy, which I wore that nickname with pride.
Brilliant. I do love it. Um, how much did your mindset at that point in time have to evolve not to be owned by these episodes of atrial fibrillation and owned by your condition?
Yeah, so I think it's a really important point that my sense of purpose was very much aligned to continuing to be a medic. Um, and so I didn't take any extended periods of time off. I would use a lot of my annual leave actually, um, instead of using sick leave, because I think there's also that sort of, hopefully it's changed now, but I think there's this perspective, or this pressure that we put on ourselves to always perform even in ill health, and we don't want to take sick days, or we don't want to be seen to be a weak part of the chain. um, Hopefully that's changed now. I think it's definitely changed now in the light of the pandemic, but yeah, I never wanted to leave medicine, and I think that's what kept me going. And I think that's a very important part of the puzzle of why I was able to overcome my condition, which isn't achievable for everyone. My experience
Yeah.
is anecdotal, and I think it's great because it demonstrates the potential for a lot of people, and we need to give people the chance. And that's why
Yeah.
I've done such a big dive in nutrition and lifestyle.
Absolutely. And I think you hit on a really good point there, that it's important to say, especially as, a cardiologist, I need to say that I see so many young patients with atrial fibrillation that have perfect lifestyles, that look after themselves really
Mm,
well, that are doing everything really well, and they still have episodes of heart rhythm issues. And that is, that's through no fault of their own. They're just going to have a different pathway to the pathway that you had. Yours was responsive, to the lifestyle changes you made, and that's excellent, but not everybody is going to have that. And certainly it is no failure needing
yeah.
medication, and it is no failure needing to go on to have an ablation. And I think you make that point very well. It is a
Mm.
really important. What for you, you mentioned purpose, you mentioned changing your food and stress levels and meditation. Was there one thing in isolation that you think had the biggest impact, or was it a combination of everything?
I think food for me was definitely the gateway drug to everything else. And I think for a lot of people, nutrition, as it's something that's so tangible and something that we do a few times a day, is the easiest thing to try and change. And I think
Mm,
intuitively, most people know that changing one's diet has an impact on their health and well-being. And so for me, that was definitely the hook that brought me towards all the other aspects of lifestyle. But in all honesty, I think they're all as important as each other. And the one that I struggle with the most, I would say, it would be a combination of sleep and stress management. And the tools that I've developed over the last few years have to be honed, and I think those are harder than nutrition.
Yeah, it's all a work in progress, isn't it? I mean, I think even as, you as a big personality who are putting out positive lifestyle messages, it's very hard for yourself. We're all a work in progress. This is all something that we need to work on collectively. And I think you're very honest about that. I personally don't think that things happen for a reason. That's just my personal philosophy. But I think that what we do is we make meaning from our life events.
Mm.
How much do you think your experience with atrial fibrillation changed the trajectory of your life and your career?
Oh, I think it's definitely been almost like a superpower. For me, at the time, it definitely it didn't feel like that at all. It was pure frustration. It was why me? It was like, I go to play a game of tennis and I flip into AF and then I have to retire. Like, it's not fair. It sounds, quite selfish to think about it in that respect, particularly when there are so many other people who have disabilities or have things that are a lot more severe. But for me, in terms of my perspective, it was really, really um, it's psychologically detrimental to me. I look back on it now and I think, what we've talked about in terms of the trajectory of my career, how it's taken me toward the root cause of a lot of people's illness. It's almost like for me, it's panned out in the way it should have. And I'm ever so grateful for that hard experience now, because it's definitely allowing me to impact hopefully millions of people's lives over the course of my career, such that we prevent disease and we prevent ill health at scale.
I think that's wonderful. And I came across this beautiful quote by Rumi, which says that it is through the wound that the light enters you. And I do believe that it's when you really struggle, it's those awful experiences that you go through that at the time seem, really life shattering. But then later on, you look back and you think, okay, that wouldn't have worked out that way if
Mm.
things had been different. Do you feel that you'd be in the same position now had that not happened?
Oh yeah, no, it'd be very different. I'd be
Yeah,
very different. I think I'd be different as a person.
yeah,
I think I would be different in terms of my personality. Absolutely.
yeah,
Let alone my career for
yeah,
sure.
yeah,
And I love that quote by Rumi. I'm definitely gonna have to.
yeah,
I love Rumi's quotes. I need to
yeah,
read a lot more Rumi.
yeah, yeah. He's great. Uh, Completely wonderful. I'm a big fan.
Mm,
And your atrial fibrillation episodes, they disappeared, didn't they, completely after making those lifestyle changes?
yeah, yeah. After about a year and a half
A year and a
of
half.
making sustained changes, yeah,
Yeah,
yeah.
yeah. Wow. Well, I'm really, really, really pleased for you, and I'm so pleased that your life took this turn and that you're spreading wellness and such positive messages, and it's come out to really mean something for you. And moving on, you're now a big media personality, aren't you? And yet you're still working on the front line. And I wanted to ask you, how does it feel when you shift that doctor-patient, very personalized relationship when you're in a consultation to being on BBC or, a morning show television program when you're spreading very broad public messages? How does your brain shift, and is it easy or difficult?
Yeah, I think it's a very different conversation. It's a very different tact I have to take, because on a one-on-one consultation you have a lot more leeway to be more personal, more open. Um, you can really give tailored advice, whereas on a show that's watched by a number of people, you have to be quite careful about the language you use, whether your message can be misinterpreted in a way. And I think you have to almost hold back on a few things that you would otherwise say in the context of a clinic, where you can define exactly what you mean. And you also have to deal. I mean, if you think clinic times are pressurized, wait till you go on TV. It's like you have like 2 minutes to get across your very important perspective on something that's a very complicated matter. And so I think that's helped in some ways to refine my Sigma in clinic. But at the same time, it's a really big challenge. Yeah.
Yeah. Well, I love what you're doing, and I think you do it very well, for the record. I think you do
Oh,
the public health
thanks.
messaging very well, and you're very concise and clear. Um, and when I see you on TV or social media, be that cooking or interviewing, you genuinely look like you're in your element, or almost like a flow state. Yet I can imagine it being a really busy life as well, with loads of, spinning plates and balls that you're juggling. How do you set your boundaries between work and relaxation?
Yeah, so it's a really good point, and one that I've taken a concerted effort to do more this year, over the last 12 months actually, because during the pandemic, I was pulled in to do more NHS stuff, which I was obviously wanting to do, volunteering as well. Um, and I realized, that's going to have an impact on everything else, because I thought I could do both, do the podcast, do the books, do the spokesperson stuff, and do NHS, and that's just not possible. So I have very clear defined times where I don't do work now. So I wake up early, first of all, very early, at 5 in the morning, where I do a lot of my work on myself. In the morning, that would be meditation, journaling, exercise, and then I will, go into the day and stuff. But at weekends, I try not to look at my laptop. And after 6 p.m., I do not look at my laptop either. So you can't find me on the but whereas before I would be on at all times, like 10 p.m., trying to fit
Okay.
everything in, trying to do everything. It's unsustainable.
Yeah.
So I'm trying to exercise Parkinson's law, which is where you give yourself that constraint for time, and you increase your productivity with those constraints, because the time when you're not working, you're also engineering your productivity as well, because that rest period makes you more productive when you do choose to work. And so I'm learning how to action that a bit more.
Parkinson's law. I will make a mental note of that to look that up
Yeah.
later. Um,
Yeah.
Now, when I was a junior registrar, I had a complaint, and I was doing an outpatient clinic. And at that time, the patient didn't want to see me. They wanted to see the consultant, which is fair enough. But on that particular day, that I think the consultant wasn't around, and it just didn't happen. So that patient had to see me, and I had to look after their blood pressure. And that then led on to a complaint. And I was absolutely mortified. And I went to my consultant and spoke to him. And he actually said, "You know what, Zareen, now you finally become a doctor. And it's because we all have complaints. And the
Mm.
more patients that you see, the more likely you are to get one. It's just, it's life. It's life of a doctor." And I feel like that is that parallels being a media personality as well. The more public
Mm.
knowledge about you and your message, the more opportunity for criticism and pushback. And I think that's inevitable. It comes with any media career. And I know that you have had some pushback and some criticism, but how have you dealt with it to stay on your path?
Yeah, I think one thing from a scientific standpoint is that you really want to welcome skepticism and criticism at all opportunities, because it helps you grow as a scientist, as a person, as someone in a position of responsibility. So that I think is something that we need to be a lot more open to. I guess when criticism stems from a place of hatred, or trying to destable you, I think that's where you have to exercise constraint, and a really hardened persona, where you can allow things to flow through you instead of getting stuck within you. And
Yeah.
and that's something I think you can only really develop when you've experienced it again and again and again. I think
Yeah.
the self assurance that is warranted for being someone who is confident enough to stand in front of a camera, or put content out there. it can only be refined over time, and you just have to experience it and get on with it. But I'm lucky in that, it's one of those things I'm really grateful for. Looking back at the time, it's painful, but when you look back on it, you're like, I learned a lot. I learned a lot about other people. I learned a lot about the connections and the social company you keep, and how important that is. And I also learned how to value your genuine connections and not bow down to our inherent negative evolutionary bias, which is to focus on the negative aspects of life. So being a little bit more considered in that respect.
And Rupy, you've achieved amazing things, incredible things for, a junior doctor to be so widely known for such a positive reason. It's amazing. And you're so humble with it as well. I remember reading you went to was it an Evening Standards Award ceremony? And you didn't actually even realise that you were one of the recipients of the awards until somebody told you that's why you're here. You're not just invited as a guest. And so you are one of the most genuine, humble people I know, with that, media power almost. But what is it that keeps you grounded?
I think it's my friends who constantly take the mick out of me and keep me humble in that respect. I think it's that NHS experience and that clinical experience, because at the end of the day, we're all just people running about on a small rock in the middle of nowhere, in the middle of this huge galaxy, and I think we have to learn to remember to take ourselves less seriously, because at the end of the day, it's all a game. I've watched Mo Gaudat's talk at Stanford Business University, probably I'd say 3 times at least now, if not more. And every time I watch that, I learn something new about happiness and perspective, and how important it is to maintain a perspective that we're really not that important, and you've just got to enjoy everything. And so I try to remind myself of that. And anytime a success comes my way, as well as a failure.
And if you could go back and give your 20-something-year-old self a bit of advice leaving medical school, what would it be?
It would be to enjoy it more, and to not take everything so seriously, I guess. I think that was the one thing that I would say to myself, but not much else.
And what does the future hold for you, Rupy?
For me, I want to continue doing what I'm doing right now, and scaling up this information as effectively as possible, so we can have the widest reach, because I want people to feel energetic, vivacious, happy, and healthy, as well as physically strong.
Rupy, thank you so much for your time. Really appreciate that you took time out of your busy schedule to join us.
No worries. My pleasure. My pleasure.
Thank you so much for tuning in. We are extremely grateful to Rupy for being so generous with his story. If someone you know could find this episode helpful, then please do share it. You can check out all the other episodes on our website, freshheartproject.com. We would be really grateful if you could comment, subscribe, and give this a 5-star rating. This helps us get the Fresh Heart message to more people. The content of this episode is not a substitute for medical advice from your healthcare professional. Remember, be kind to yourself, and small, sustainable steps have the power to transform your life. This podcast is produced by Lion Mountain Entertainment, a subsidiary of Morgan Archway Limited.